Experimentally recently combined modafinil and Valium in quite large quantities just to see what would happen really, and I found that it actually made for quite a sexually stimulating concoction, which I wasn't expecting at all.
When Mixie was sort of first on the scene, we had really fun adventures with that. I remember sort of losing my sense of self so much. I mean, it doesn't just separate mind from the body, it separates your mind from your identity. The sensation that you're dying is very real.
I have exams coming up again in a few weeks' time, and I would intend to take Ritalin again. I found my propensity to learn and concentrate grew exponentially, and the effect that that had on my resultant grades was great.
Probably got through the best part of a gram and a half of MDMA. Generally, I see them as a convenient shortcut to a mental state that I would like to occupy. And those mental states are obtainable for me organically. It just requires a lot more effort.
Mainly MDMA, small amount of TCB, and then perhaps some Valium towards the end of the evening. I like to take drugs on certain occasions because I enjoy the heightened sense of experience that I gain from that. With some of them as well, I enjoy the exploration of your mind that it gives you, and experience sensations and thought processes that you can't otherwise experience.
About a year and a half ago, I got into research chemicals, which present a much more fascinating kind of approach to getting to different mindsets, because it's not really about being high. Absolutely astonishing visuals and mindscapes and states of mind.
Up until quite recently, I was getting through quite large amounts of methadone on the weekends, just because it was sort of a Friday, a release. I just want to be up, I want to be full of energy, and because I was putting so much of it up my nose, it took my body quite a while to get it out during the week, I think, and so it started to affect me sort of Monday, Tuesday, Wednesday, and then by Thursday, Friday, I'm back on it again.
With study drugs, I have experienced some more negative consequences, and I'd be more careful in taking them, perhaps because they did have quite, and they're obviously supposed to have quite profound effects on your personality for the period or duration of time that you're taking them.
With the right research, with the right set and setting, with a good pair of scales, you've done everything that you can to make it as safe as possible.
I think maybe skunk was a bit of a problem for me in the sense that it spaced me out to the extent where I felt sort of glazed and not particularly communicative, perhaps sometimes paranoid and quite demotivated.
I would say I'm in completely control of my drug use. I'm a habitual cannabis smoker, but I'm not so much of a habitual drug taker of any other drugs.
Very happy, very content. It's a hobby. I derive a lot of entertainment and fascination out of it.